My name is Lainey, and today we're going to discuss celiac disease. Celiac is a gastrointestinal and autoimmune disease that affects the lining and the villi of the small intestine, which is responsible for nutrient absorption. It occurs when someone who is sensitive to gluten ingests a gluten product like wheat, barley, rye, or anything that is associated with any of those products. It can develop at any age, but it most commonly develops at childhood. And those who are more prone to the condition are those who are related to somebody with the condition by first or second degree, someone of European ancestry, someone with a disease or a disorder already, such as a migraine or myocarditis that is associated with celiac disease. And it actually is most commonly found in women. This condition affects about 1% of the population in the United States. Diagnosing celiac disease is a combination of obtaining a comprehensive history and physical exam, obtaining blood work with an elevated number of antibodies, and doing a biopsy of the small intestine. So when someone is suspected of having celiac disease, they'll first obtain blood work. And if that person ingests gluten, their body will view gluten as a response and produce an elevated number of antibodies. So that's what they're looking for for the blood work. If that comes back positive for elevated antibodies, then they'll do one of two tests. They'll either perform an endoscopy, where they'll take a camera and they'll insert it down into the stomach and the small intestine, or they can do a capsule endoscopy, which will take pictures all the way down until it is digested completely. And what they're looking for is a flattened mucosa of the intestine or a noticeable loss of villi. Because food and nutrients are not being absorbed by the small intestines appropriately, the symptoms that you'll most likely find is a foul-smelling diarrhea, steatorrhea, which is the excretion of all the fat that is being ingested but not being absorbed into the body, flatulence, abdominal distension, and malnutrition. And that malnutrition will cause a weight loss, and it'll cause muscle wasting. It may even cause, in the beginnings, until a diet is worked out, a lactose intolerance, therefore not obtaining the calcium that they need. And that will lead towards less common symptoms such as osteoporosis or dental enamel thinning, iron and folate deficiencies, peripheral neuropathy, and reproductive issues. And some patients even get vesicles or rashes on their scalp, on their face, on their knees, on their elbow, or their buttocks. Celiac disease can be very serious if not discovered and treated appropriately, as it can lead to other deficiencies. For example, children who don't know that they have it, it can actually stunt their growth and development or halt it altogether. People will be at an increased risk for GI cancers, iron deficiency anemia due to the malabsorption of iron, B12 and folate deficiency anemia because they're not digesting enough B12, osteoporosis due to not having enough calcium, and a lactase deficiency due to not being able to digest and absorb the calcium. These issues can then lead to more serious disorders such as ADHD, epilepsy, diabetes mellitus, different forms of intestinal cancer, and infertility. The only way to effectively manage celiac disease is through a gluten-free diet, and a patient will need to maintain this diet throughout the course of their lifespan. Consulting with a dietitian will be important so that they can find a diet plan that is within their budget restraints, as gluten-free products can be quite pricey. And people who don't respond well to diet alone can also be prescribed corticosteroid therapy. If your patient has celiac disease, then you want to make sure that they're getting adequate nutrition, that they're able to maintain an adequate fluid balance, And if they're children, that they're still able to properly hit all of their developmental milestones. Nursing interventions include medication administration for nausea, vomiting, and diarrhea as prescribed by the physician. Monitor the electrolytes as they are at risk for being out of balance, and encouraging fluids that they are losing from vomiting and diarrhea, or provide those fluids via IV. Monitor their weight on a daily basis to ensure they're not losing too much weight due to malnutrition and malabsorption of nutrients, and provide education on what they can eat. Refer them to a dietitian so that dietitian can help them establish a diet that works within their budget and teach them how to read a label. Advise them that there are companies that actually cross-contaminate or create their gluten-free food in a gluten-contaminated facility. So they'll need to watch out for that. In their medications, sometimes medications actually use gluten in their ingredients, and there are activities such as modeling play that also utilizes gluten in their ingredients. So you want to instruct them to stay away from those types of products. Encourage them to utilize a food journal so that they can monitor and track their food triggers or activity triggers. Encourage oral supplements of calcium that they may not be getting enough of, or of vitamin A that they may not be getting enough of due to the inability to have gluten. And refer community resources. There are several things in the community that will help them monitor their daily life. They can download apps onto their phone, so when they go to a restaurant, they can already pre-select a gluten-friendly meal. There are health food stores all over and within distance of where they live that will provide gluten-friendly foods. And there are lots of gluten-friendly foods that are popping up at a regular grocery store every day. There are also 2 celiac foundations that will help someone monitor their disease in everyday life. There's the Celiac Sprue Association and the Celiac Disease Foundation.